Mga tanong na maaaring lumabas ngayong darating na Philippine Nursing Licensure Examination ang alay ko sa iyo for today. Board exam type of question that will cover your medical and surgical nursing with rationalization. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals with their studies. If that's something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that out. Subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video. Hi nurses! Welcome back nga sa ating session, and panibagong session ng ating nursing test banking. For today, we are going to have, kagaya ng sinabi ko kanina sa intro, medical surgical nursing. Yes, possible questions na maaring lumabas at maulit ngayong darating na board exam. This is another entry natin sa ating nursing test banking where I create questionnaires, questions that will possibly na pwedeng lumabas sa mga board exam questions kagaya ng NCLEX, CBT, HAAD, PROMETRIC, okay? One good thing about this video is that I'm not just gonna give you questions, but I'm also gonna explain to you the rationalization per each answer. And if you're gonna take something out from this video, I want you to take the rationalization. I also would like to encourage you to put your scores sa baba sa comment section para malaman ko kung ano ang score mo. Okay? Kung hindi mo pa napapanood yung other test bankings at other nursing educational contents na ginawa ko, ilalagay ko yung playlist link sa description box or simply click this icon button right here kapag nagpop-out yon. Now, in order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit.
Alright, so hi everyone. Welcome back sa ating formal discussion ng iyong medical surgical nursing test bank. Yes, ito nga ay isa sa mga videos na kinecreate ko para makatulong sa iyo sa paghahanda mo sa darating na board examination natin dyan sa Pilipinas. Na kung hindi mo pa napapanood yung other videos ko regarding sa Pnle, mga board exam type of questions with rationalization, I'll be putting the actual playlists sa description box or you can check out the icon button kapag nagpop-out yon. Now, hindi ko na patatagalin to ha. Ibibigay ko na sa iyo ang objectives. Now, I'm gonna provide you and discuss to you the board exam type of questions, and I'm also gonna provide the rationalization per each board exam type of questions. Exciting, hindi ba? Let's proceed. Now, I'm gonna give you the instructions on how this video exam will go, itong nursing test banking natin. Now, you will be given 25 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each questions, and the answer is revealed instantly after each questions with rationalization. Choose the letter of the correct answer. Good luck, nurses. Handa ka na ba? Let's begin. Board exam type of question number 1. Marco, who has diagnosed with brain tumor, was scheduled for craniotomy. Okay, let me change my pen right here. In preventing the development of cerebral edema, ano ang scenario preventing the development of your cerebral edema post-surgery? The nurse should expect the use of A. Diuretics, B. Antihypertensive, C. Steroids, D. Anticonvulsants. Your 5 seconds starts now. Alright, nurses, time's up. The answer is, maaaring may iba sa inyo sumagot ng diuretics, but that's not the correct answer because the correct answer to this question is letter C, steroids. Why? Glucocorticoids or steroids are used for their anti-inflammatory action, which decreases the development of your edema. The answer is letter C. Alright, question number 2. Before further proceed, I would like to remind you na take this examination as if you are taking the board exam, ha? Ang pinagkaiba lang ay ako yung nagbabasa ng tanong at pati ng choices. Now, I want you to think as if, think what's on top of your head, okay? It doesn't matter how how many correct answers you get, but I want you to take away the rationalization per each questions, okay? Sa mga board exam na ganyan, NCLEX, CBT, at PROMETRIC, minsan, madalas na uulit ang tanong. So the more you get exposed to the types of question for each nursing examination, the more the chances of you passing the exam. All right, so let me read to you the question. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should nag-complain ng lumbar pain ng pasyente mo during BT halfway through. A. Increase the flow of normal saline. B. Assess the pain further. C. Notify the blood bank. D. Obtain vital signs. Your 5 seconds starts now. Alright, time's up. The answer is letter A. Increase the blood flow or increase the flow of normal saline. The blood must be stopped at once, and then normal saline should be infused to keep the line patent and maintain blood volume. Hence, the answer is A. Board exam type of question number 3. Nurse Maureen knows that positive diagnosis for HIV infection. Anong tinatanong? Positive HIV infection is made based on which of the following? Tinatanong ka kung ano ang confirmatory test ng iyong HIV. Is it A, history of high-risk sexual behaviors, B, positive ELISA and Western blot tests, C, identification of an associated opportunistic infection, D, evidence of extreme weight loss and high fever? Your 5 seconds starts now. Time's up. The answer is letter B. Bonus question ito ha. ELISA and Western blot test. The confirmatory test of your HIV is ELISA test. Now, these tests confirm the presence of HIV antibodies that occur in response to the presence of the human immunodeficiency virus, HIV. All right, board exam type of question number 4. Nurse Maureen is aware that the client who has been diagnosed with what? Chronic renal failure recognizes an adequate amount. Anong sitwasyon mo? Adequate amount of high biologic value protein. High protein diet when the food and the client selected from the menu was, is it A, raw carrots? Is it B, apple juice? C, whole wheat bread? Or D, cottage cheese? In short, ang tanong padadalain ko ha, alin dito ang rich in protein? Your 5 seconds starts now. Time's up. The answer is letter. Very good. Letter D, cottage cheese. Now, 1 cup of cottage cheese contains approximately 225 calories, 27 grams of protein, 9 grams of fat, 30 milligrams of cholesterol, and 6 grams of carbohydrates. Proteins of high biologic value contain optimal levels of amino acid essentials for life. All right. Number 5, Kenneth, who was diagnosed with uremic syndrome, has the potential to develop complications. Which among the following complications should the nurse anticipate? In short, tinatanong ka, ano ang possible complication ng iyong uremic syndrome? Si Kenneth ay may uremic syndrome. Ano ang pwedeng komplikasyon na man-develop sa kanya? Is it A, flapping and hand tremors? Flapping hand tremors. B, an elevated hematocrit level. C, hypotension. D, hypokalemia. Your 5 seconds starts now. Time's up. The answer is letter A, flapping hand tremors. Bakit? Elevation of uremic waste products causes irritation of the nerves resulting in flapping hand tremors. May singit ko lang ha, gumawa ako ng video about sa mga normal values natin. Natalakay ko itong hematocrit, hemoglobin, and all other blood studies na meron tayo. Huwag ka mag-alala, dadagdagan natin yung ating mga videos regarding sa nursing normal lab values. Alright? So, kung hindi mo pa napapanood yun, panoorin mo. Part 1 and Part 2 na yan. Okay? Let's proceed. A client is admitted to the hospital with benign prostatic hyperplasia, BPH. That's the case. The nurse most relevant assessment would be assessment for your benign prostatic hyperplasia, alin dito? Flank pain radiating in the groin. B. Distension of the lower abdomen. C. Perineal edema. D. Urethral discharge. Your 5 seconds starts now. Nurses, time's up. The answer is letter B. Distension of the lower abdomen. Bakit? Nurses, this indicates that the bladder is distended with urine, therefore palpable. Period. Number 7. A client has undergone with penile implant. After 24 hours of surgery, the client's scrotum was edematous and painful. 24 hours post-surgery, ang scrotum ng iyong pasyente, bayag ng pasyente mo daw ay namamaga at nagko-complain ng masakit. The nurse should, ikaw bilang nurse, anong gagawin mo? A. Assist the client with sitz bath. Sapokin kita. B. Apply war soaks in the scrotum. C. Elevate the scrotum using a soft support. Or D. Prepare for possible incision and drainage. Yang galing! Your 5 seconds starts now. Time's up. What's your answer? Letter C. Elevate the scrotum using a soft support. Why? Elevation increases lymphatic drainage, reducing edema and pain. Period. Alright, Nurse Hazel receives emergency laboratory results for a client with chest pain and immediately informs the physician. An increased myoglobin level suggests which of the following? Kapag may increased level ng myoglobin ng pasyente mo, ano? At ilagay mo to, isama mo tong chest pain assessment mo. Itong dito, complaint ng pasyente mo, chest pain at may myoglobin. Ano kaya ang posibleng nararanasan or diagnosis ng iyong pasyente? Is it A. Liver disease, B. Myocardial damage, C. Hypertension, D. Cancer? When you answer questions for board exam, take notes of those key terms. Kaya napapansin mo ako dito, naglilinya ako as I read the question para makatulong yun sa'yo to lead to the right answer. Elimination process and looking for keywords. All right? So your 5 seconds starts now. Time's up. The answer to this question is letter B, myocardial damage. Chest pain, myoglobin. Paliwanag ko sa'yo bakit. Detection of myoglobin is a diagnostic tool to determine whether myocardial damage has occurred. Okay? Number 9, Nurse Maureen would expect the client with mitral stenosis would demonstrate symptoms associated with congestion in the mitral stenosis. Ano ang mga symptoms ng merong may mitral stenosis? Congestion saan? Is it A. Right atrium, B. Superior vena cava, C. Aorta, D. Pulmonary? Okay? So, isipin mo, mitral stenosis. So mitral valve. Isipin mo ano yung mga maaring i-relate mo sa mitral valve mo. Your 5 seconds starts now. Time's up. The answer is letter D, pulmonary. When mitral stenosis is present, the left atrium has difficulty emptying its contents into the left ventricle because there is no valve to prevent backflow into the pulmonary vein. The pulmonary circulation is under pressure. Board exam type of question number 10. A client has been diagnosed with hypertension. The nurse, anong case mo? Hypertension. The nurse, you as a nurse, priority nursing diagnosis for patients with hypertension is it A, ineffective health maintenance, B, impaired skin integrity, C, deficient fluid volume, or D, pain? Your 5 seconds starts now. All right, time's up. What's your answer? Letter A, perfect. Ineffective health maintenance. Managing hypertension is the priority for the client with hypertension. Clients with hypertension frequently do not experience pain, deficient volume, or impaired skin integrity. It is a symptomatic nature of hypertension that makes it so difficult to treat. All right? Next, Board exam type of question. Number 11. Nangangalahati na tayo. Gumalaw-galaw kayo, ha? Alright. Okay. Ako, iinom lang ang tubig. Alright. Number 11. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin. Huwag malilito sa tanong ha. Binigyan ka lang ng parang history or story. Pero ang tanong dito, side effects lang ng iyong nitrogly. Sana makatulong itong picture na ito sa iyo at sa mga ginagawa ko. I'm really trying to, put pictures na magagamit mo sa pagre-review mo. Is it A, high blood pressure, B, stomach cramps, C, headache, D, shortness of breath? Your 5 seconds starts now. Time's up. The answer is letter C. Headache. Why? Because of its widespread vasodilating effects, di ba? Vasodilation, ang effect ng iyong, ang gusto mong effect mula sa nitroglycerin. Bakit? Kasi it increases the blood, through vasodilation, it will increase blood volume on the myocardium, which is the major muscle for contraction of the heart. Nitroglycerin often produces side effects such as headache, hypotension, and dizziness. Dahil sa vasodilation, nagkakaroon ng headache, hypotension, and dizziness. So, high blood pressure, no. Okay? Next, number 12. The following are lipid abnormalities. Which of the following is a risk for the development of atherosclerosis and PVD? Anong case mo dito? Atherosclerosis and PVD. Is it A? Wait, ano ibig sabihin ng PVD, nurses? Peripheral vascular disease. Okay? Sige. Letter A. High levels of low-density lipid, LDL cholesterol. B. High levels of high-density lipid, HDL cholesterol. C. Low concentration of triglycerides. D. Low levels of low levels of LDL cholesterol. Your 5 seconds starts now. Time's up. The answer is letter A. High levels of low-density lipid cholesterol. An increase in LDL cholesterol concentration has been documented as risk factor for the development of atherosclerosis. LDL cholesterol is not broken down into liver but is deposited into the wall of the blood vessels. Board exam type of question number 13. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? After surgery ng iyong aortic aneurysm repair, ano yung high risk mo? Ano yung important risk mo na dapat mong tingnan sa pasyente mo? Is it A, potential wound infection? B, potential ineffective coping? C, potential electrolyte balance? D, potential alteration in renal perfusion? Tinatanong ka dito, ano yung mga possible nursing scenarios na ma-encounter mo post-surgery of your aortic aneurysm? Your 5 seconds starts now. Time's up. The answer is letter D. There is a potential alteration in renal perfusion manifested by decreased urine outputs. That's your complete nursing diagnosis right there. The altered renal perfusion may be related to renal artery embolism, prolonged hypotension, or prolonged aortic cross-clamping during the surgery. Nakuha mo yon? Sige. Ayun na. Board exam type of question number 14. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12. All right? So A, dairy products, B, vegetables, C, grains, or D, broccoli. Your 5 seconds starts now. Time's up. The answer to this question is letter A, dairy products. A good source of vitamin B12 are dairy products and meat. Balikan natin, nurses, ha? Ano yung vitamin B12 mo? Ano yun? Cobalamin. Okay? Huwag malilito. So, high source nga ng yung cobalamin or vitamin B12 is dairy products and meats. Alright? Next, number 15. Karen has been diagnosed with plastic anemia. Ano ang senaryo mo? Plastic anemia. Ano sinabi ko? Plastic anemia talaga. Plastic anemia. I'm sorry. The nurse monitors for changes in which of the following physiologic functions. Ano ang changes na makikita mo physiologically sa pasyenteng diagnosed with a plastic anemia? Is it A, bowel function, B, peripheral sensation, C, bleeding tendencies, D, intake and output? Your 5 seconds starts now. May idea ka na, sinabing aplastic anemia. Yung sagot na bleeding tendencies. Okay, why? Aplastic anemia decreases the bone marrow production of RBCs, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. Period. Nako, malapit na tayo. Number 16. Lydia is scheduled for elective splenectomy. Elective splenectomy. Before the client goes to the surgery or to surgery, the nurse in charge, final assessment would be. Final assessment mo, pre-surgery or pre-surgery ng pre-elective splenectomy. Is it A, signed consent, B, vital signs, C, name, band, or D, empty bladder? Your 5 seconds starts now. Time's up. The answer is letter B, vital signs. An elective procedure is scheduled in advance so that all preparations can be completed ahead of time. The vital signs are the final check that must be completed before the client leaves the room so that continuity of care and assessment is provided for. Gets yon? Gets. Kasi itong sign consent, name band, empty the bladder, ginawa mo na yan before. Final assessment ang tanong. Bago talaga pumasok sa pinaka-room, surgery room. Okay? All right. Number 17. What is the peak age range? Peak age range in acquiring acute lymphocytic leukemia, ALL. Is it A, 4 to 12 years, B, 20 to 30 years, C, 40 to 50 years, or D, 60 to 70 years? I'm sorry, typographical error po yan. 60 to 70. Your 5 seconds starts now. All right, the answer is letter A, 4 to 12. The peak incidence of acute lymphocytic leukemia is 4 years of age. It is uncommon after 15 years of age. Okay? All right, let's proceed. Board exam type of question number 18. Mary with acute lymphocytic Mary with acute lymphocytic leukemia suffers from nausea and headache. These clinical manifestations may indicate all of the following except negative question. Lahat ito, pag nakakita ka ng ganyang tanong, ng ganitong klaseng forma ng tanong, tinatanong ka lahat ito, paano mo siya interpret? Lahat ito ay signs and symptoms, clinical manifestations ng anong case mo dito? Lymphocytic leukemia. May isa dyan, hindi. Alin dyan ang hindi? Is it A, effects of radiation, B, chemotherapy side effects, C, meningeal irritation, or D, gastric distension? Your 5 seconds starts now. Time's up. The answer is letter D, gastric distension. Lymphocytic leukemia, or ALL, does not cause gastric distension. It does invade the central nervous system, and clients experience headaches and vomiting from meningeal irritation. Alright, malinaw yon? Malinaw. Board exam type of question number 19. A client has been diagnosed with disseminated intravascular coagulation, DIC. Which of the following is contraindicated with the client? Contraindication for patients with DIC, disseminated intravascular coagulation. That's the question. Is it A, administering heparin, B, administering comadine, C, treating the underlying cause, or D, replacing depleted blood products? Your 5 seconds starts now. Time's up. Na bago ko ibigay sa iyo ang tamang sagot, gusto ko lang may palala sa iyo na itong mga questions na to ay nakuha ko ng mga nakaraang board exam 4, 3, 5 years ago or more. Kinuha ko siya at kinumpile ko siya sa isang sa video na to para may gamitin kang reference, okay? Hindi natin alam, baka ito palang tanong na dinidiscuss natin ngayon about sa DIC ang lumabas sa board exam at pag nasagot mo to, ito ikakapasa mo, kaya makinig ka. So the answer to this is letter B. Disseminated intravascular coagulation, DIC, has not been found to respond to oral anticoagulants such as Coumadin. Coumadin is an oral anticoagulant per orem. Hindi nagre-respond ang DIC dyan, okay? Kaya contraindicated siya. Next, last 6 questions na lang tayo ha. Which of the following findings is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Indication mo na effective ang iyong fluid replacement sa isang pasyenteng may hypovolemic shock. Is it A, urine output greater than 30 ml per hour? Is it B, respiratory rate of 21 breaths per minute? C, diastolic blood pressure greater than 90 millimeters of mercury? Or D, systolic blood pressure greater than 110 millimeters of mercury? Your 5 seconds starts now. All right, what is the answer? Letter A. Urine output provides the most sensitive indication of the client's response to therapy for hypovolemic shock. Urine output should be consistently greater than 30 to 35 ml per hour. All right, so the answer is A. Board exam type of question number 21. Which of the following signs and symptoms would Nurse Maureen include in teaching plan as an early manifestation, early sign daw ng iyong laryngeal cancer? Alright, is it A, stomatitis? Sorry ha, typographical error tong A. Stomatitis po yan. B, airway obstruction. C, hoarseness. Or D, dysphagia. Sasapukin kita pag di mo alam to. Common to sa MS. Tinatanong. Your 5 seconds starts now. Time's up. The answer is letter A. Diba? Hoarseness of voice. Early warning signs of laryngeal cancer can vary depending on tumor location. Hoarseness lasting 2 weeks should be evaluated because it is one of the most common warning signs. Alright, pagkapaos. Parang ganito. Okay? Board exam type of question number 22. Karina, a client with myasthenia gravis, MG, is to receive immunosuppressive therapy. Maisingat ko lang, tinalakay ko na tong MG na to. Gumawa ako ng discussion about sa MS. About sa MG. Meron akong playlist where I discuss about medical surgical nursing, some of the disease process, nursing management mo, nursing care plan mo, nursing care management mo sa mga pasyenteng may mga ganitong klase ng diseases. Hindi lang to, napakarami ko ng video regarding sa medical surgical nursing. That's actually one of my expertise, may forte, magkaroon tayo ng masteral dyan. So I'm just saying, kung hindi mo pa napapanood yun, panoorin mo, ililink ko siya dyan, ha? Kasama ng ibang mga concept or video playlists na ginawa ko under nursing education. Na magpatuloy tayo. The nurse understands that this therapy is effective because so, ano ang effect? Ang tanong sa'yo, bakit nagbibigay ng immunosuppressive drugs at bakit under immunosuppressive therapy ang pasyenteng may MG? Is it A, promotes the removal of antibodies that impair the transmission of impulses? B, stimulates the production of acetylcholine at the neuromuscular junction? C, decreases the production of autoantibodies that attacks acetylcholine receptors? Or D, inhibits the breakdown of acetylcholine at the neuromuscular junction? Your 5 seconds starts now. Time's up. The answer is letter C. Why? Steroids decrease the body's immune response, thus decreasing the production of antibodies that attack the acetylcholine receptors at the neuromuscular junction. Itong picture na to, makakatulong yan sa'yo para mas maintindihan mo, okay? Last 3 questions, board exam type of question number 23. A female client is receiving IV mannitol, an assessment specific to safe administration of the said drug o administration ka ng IV mannitol mo sa pasyenteng nakamanitol. Is it A, vital signs Q4? Q4, every 4 hours, or B, weighing daily, C, urine output hourly, D, level of consciousness, Q4. Your 5 seconds starts now. O, para maunawaan mo, kapag may mga drug-related questions, dapat mo maintindihan para saan ba itong mannitol. Ganun ang thought process, okay? So, mannitol, diuretics to. So, para malaman ko kung ano ba yung pag-ihi ng ihi diuretic. So, ang titingnan ko doon regarding sa ihi, maghahanap ako dito na may kinalaman sa fluid, sa weight, may kinalaman sa urine, mga ganon. So, the answer to this, obvious na obvious, letter C, urine output hourly. The osmotic hourly. The osmotic diuretic mannitol is contraindicated in the presence of inadequate renal function or heart failure because it increases the intravascular volume that must be filtered and excreted by the kidney. All right? Board exam type of question number 24. Last two. Galingan mo. Galingan natin to. Patricia, a 20-year-old college student with diabetes mellitus, requests additional information about the advantages of using a pen-like insulin delivery devices. The nurse explains that the advantages of these devices over syringes includes, bago ko basahin yung choices, nagkaroon ako ng drug study about types of your insulin. Meron tayong dong rapid acting, short acting, meron din tayong, ano ba yung mga ano ba yung mga nilagay ko doon? Rapid acting, ano ba yung mga type? Basta meron akong video noon about sa insulin. Pinadali ko yung buhay mo kung paano mo siya mamememorize. Ililink ko siya dyan under ng pharmacology or nursing mnemonics. Panoorin mo siya, ha? O, ito ng choices. Accurate dose delivery. B, shorter injection time. C, lower cost with reusable insulin cartridges, reusable, girl. The use of smaller gauge needle. Your 5 seconds starts now. All right. The answer is letter A, accurate dose delivery. These devices are more accurate because they are easily to use and have improved adherence in insulin regimens by young people because the medication can be administered discreetly. Okay? Prepared na kasi to, kaya the answer is A. Last question na tayo, nurses. Board exam type of question number 25. A male client's left tibia is fractured in an automobile accident, and a cast is applied to assess for damage to major blood vessels from the fractured tibia. Assessment ng major blood vessels mo sa tibia. The nurse in charge should monitor the client for A, swelling of the left thigh. B, increased skin temperature of the foot. C, prolonged perfusion of the toes after blanching. Or D, increased blood pressure. Your 5 seconds starts now. Time's up. The answer is letter C. Prolonged reperfusion of the toes after blanching. Damage to blood vessels may decrease the circulatory perfusion of the toes. This would indicate the lack of blood supply to the extremity. Yes, nurses, tapos na nga tayo. Thank you so much for listening, for answering the questions with me. And please like, share, and subscribe to my channel for more nursing educational videos, ha? Let me know if you have other nursing topics that you want us to do. Put it down on the comment section below. Abangan nyo po yung mga next nursing test banking natin, ha. Kasi sa mga susunod, hindi ko lang binabalak na i-cover yung Pnle, pati na rin yung NCLEX, HAA, DHA, CBT, PROMETRIC, at kung ano-ano pa. Okay? Huwag ka mag-alala. Nurses, pakilagay ang score sa baba. Gusto kong ma-evaluate anong score ng mga pasyente. Pasyente talaga ng mga students ko, okay? I'll be more than happy. Once again, huwag mahihiya kung anong score mo. Ipagmalaki, pinaghirapan mo yan. Alright. Ipamalita mo na ang pinakabago, pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. I'll see you again next time.
Thank you so much, you guys, for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. Hashtag Team Kuta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box. You simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gave, except for my TikTok account, which is Neil Gave Official. I also would like to encourage you to follow, like, and share my Facebook page. It's Neil Gave. I'm gonna be putting it here. Yes, and I'll see you again next time. You have a good one.